Hi, I'm Dr. Clarence Lei. This is the preparatory course for the SIT exam of the Board of Urology of Malaysia. And I've been allocated the title of what the examiners are looking for. And I've only have 15 minutes, so it'll be a fairly fast Zoom. The specific learning objectives are to tell you the things that you can do to try to pass this postgraduate examination. I will make use of real life cases, practical advice from the Malaysian situation. I've been an examiner with the UNIMAS since 1995, and I examined with the Malaysian Board of Urology in the year 2000, later with the FRCS exam in the year 2009. So I can tell you from good experience of what my real life cases is with the exam. I presume none of you want to fail the exam. You're all motivated to pass the exam because failure will mean effects on your career, your mental health, on money, and also to getting on the specialist register on time. So I'll give you some pointers. When I did the exam in 1990, there were 2 examiners on a table with 1 candidate, and there is an assortment of material, often open-ended table. In the year 2000, when we had the exam in Malaysia, it was a very similar exam with only 3 examiners, with Dato Shabuddin, Tony Mandi, and myself. And we carried on a similar system with external examiners from Singapore, from Australia, until the year 2007, when then we move on to have the FRCS Urology from Glasgow. There is itemized question, itemized marking, but in the end, there's still a global marking scale. This is the MRCS examination that have been involved in the last 5 days, and it goes back to the global marking as well. So the old system is still relevant. You also know who are the examiners. Usually there are 4 to 6 external examiners. Now it's all from Glasgow, and there are about 10 local examiners. To be an examiner, you have to be 5 years in consultant practice. You still have to be in practice for the last 5 years. You have to be a trainer, and you must attend prescribed courses. The examination question writers, however, are usually the young consultants in Malaysia, unlike for the MRCS and the cardiothoracic, where the examination questions come from overseas. There are some senior examiners who are actually assessor examiners. So you can Google them and you know who are the examiners who are taking you. You also know what are the exam questions. For the FRCS Urol, there are 8 tables: Urology, Oncology 1, Oncology 2, Pediatric Urology, Emergency Urology, Calculi and UTI, Urology Imaging and Principles of Urologic Technology, Bladder Dysfunction and Female Urology, and finally BPH and Andrology. And the questions are often or very similar recycled questions. So you can actually know what that exam questions. The exact format of the exam questions for the urology exam is also well known. It is made up of clinical scenarios through a patient journey. There will be about 3 to 6 fragments for 10 minutes. And the fragments advance you through basic competence and advanced levels like this. So the history will be very brief, not much on physical. There will be investigations. Sometimes the pictures are not very clear, but the examiner will help you on. There will be a diagnosis. Usually you know the diagnosis because you are entering the room with the specific topic. There will be management options to discuss with, and the examiner will lead you to one discussion option on management. Then we talk about complications, options, informed consent, epidemiology, risk factors, prognosis, and then sometimes we talk about studies. So if you do not reach at least 3/4 to the exam, it is not easy to pass the exam. So don't get stuck at history and physical or just the basic investigations. The exam questions are pre-designed. They are calibrated the day before. They are usually drafted by local examiners a few months before the exam. The examination scenarios may be similar, but don't give a robotic answer. The exam questions are not leaked. Sometimes you look at it, it appears to be the same question, but the exam question and answer may be different. There's a script of marking. So if you ask one question, give one answer. Don't give 2 answers and declare something else. For example, if they ask you what is DMSA, don't talk about DTPA and MAC3. You know, if it's outside the exam room, you can talk other things in the word round, but not during the exam. Just give one answer to one question. The marking scale is very close. 5 is a fail, not a pass, not a pass. If you reach to the end, you can give them knowledge about consent, knowledge about epidemiology, about studies, then you can get an 8. And it's not uncommon for many candidates to get many 8s, but you need 6, 7, because sometimes you may get a 5. So you need to do fairly well in all the stations. How do you prepare for the exam? You have to read one textbook cover to cover. Some people say you have to read Campbell, but I don't think so. Campbell is more of a reference book. Whenever you think of a case, you see in the ward, think of the history, the investigations, the various operation techniques, the complications, the prognosis, the consent, and the publications. So if you think along those lines, or for every case you read in the ward, you make a reference. This is a good practice for the exam. And for the 6 months before the exam, you should not be staying in the apartment. You should go to the ward to see patients with colleagues. You see real life cases and go along the cases according to this kind of thinking to fit a clinical scenario for the exam. You also have the advanced courses. So you will have to study the advanced courses. So if you do not attend the advanced courses like this candidate, then you're just wasting your chance to pass the exam. These advanced courses are prescribed, and often the examiner is the one who is sitting in, listening to the course. During the last 6 months, you have to rely on your short-term memory, form a dynamic study group using WhatsApp, share papers, share past exam questions, listen to podcasts, keep all the important figures in the black book or in your device so that you're ready to quote, and prepare standard Q&As to the 8 important topics. In the last round, the last 1 month, last 2 weeks, sleep well, don't go on call, revise your written notes, don't revise piles of textbooks. The essential reading will consist of EAU guidelines and all the international preparatory course will tell you that you have to read around the recent journals. And by journals, I mean BJUI, European Urology, J-Uro. These are the important journals that you have to read on the latest papers so they can quote them. Now, impression counts very much. And I think this exam in November will be a face-to-face meeting. Make sure your hair is combed, your shirt is not crumpled, your coat is nicely tailored and fitting. Be confident, be affable, smile, but don't smile all the time and don't be too confident. Display your candidate number clearly. Speak clearly, not softly, and not too fast. Your mannerism also counts. Don't cover your face. A lot of Malaysians like to shake their legs when they are stressed. Sit upright. Of course, don't dress like this girl. Be careful with attire. Don't be too eye-catching. I can tell you in the recent FRCS exam, quite a few candidates actually did not tuck their shirt in. And some girls actually dress up in very eye-catching, which actually distracts the examiner. I think we're still living in the COVID time or very similar situations. I think the regulation says that you have to wear a mask indoors. During the FRCS exam, almost all the external examiners do not wear masks. They believe that if you're sitting in an exam room where there's 1 meter apart, 1 or 2 meters apart, that social distancing is sufficient. I think if you wear a mask, you run the danger of not speaking well, and also your facial expression may be missing. If you're symptomatic, then of course you have to wear a mask, and if you like, you can do your own self-testing. Let's hope that we can do a face-to-face exam during this November. Be careful with your language. Most of the examiners are on the elderly side like myself, so don't say elderly 65-year-old patient, and address the examiner as sir or Mr. or doctor. Don't use the word boss all the time, and also don't ask the examiner how you perform because they cannot tell you. If you can't answer a question, some examiners will throw you an off-cuff question like, what is AMH? You try to answer. If you can't answer, say, can I move on? Do not say, I don't know. Because most of you actually do know the answer, but you don't know it right there and then. You must try to reach about 3/4 way through your scenario to try to reach up to management. Do not be intimidated by the examiner. If you reach to the end, some examiners will ask you some off-the-cuff strange questions. Don't be intimidated because they may be just testing the boundaries of your knowledge. Listen very carefully to the examiner. Allow the examiner to lead you on. If the examiner cut you short, it's likely that your answer is wrong. So if you ask a question like, what's your name? Just give your name, Clarence Lei. Don't add to the answer. Listen very carefully. Do not give a presumed answer that is running in your mind. So if people ask you what is the role of ultrasound in a bilateral impalpable testis, don't say ultrasound is to look for testis in the scrotum. So be very careful when you give the answer to the examiner. So sleep well the previous day. If you have a thought block due to anxiety, like some people, use paper. You ask the examiner to rephrase the question, or you can repeat the answer, but don't freeze for too long. What if you give a wrong answer? You can still move on. The examiner may give you the answer so that you can move on and proceed to the next question. In the modern examination, there's no such thing as a killer question. So if you have a completely wrong answer, don't be disheartened, move on. For example, in 1 year, 2 candidates give a completely wrong answer regarding the number of shocks. Typically, we give to ESWL. They both said 500 shocks, but one of them still passed the exam because he has a few sevens in the answer. Now, this is a high-stake exam, exit exam. So some of you may have panic disorder, you may have reactive depression. So it's very important you have backup psychological mechanisms. The family is important. Have a pet, a dog or cat. Make sure you have enough exercise. Go for walking, go for a swim, light exercise. Make sure you sleep well. Try not to sleep beyond midnight during the weeks running up to the examination. If you really feel that you're under undue stress, go and see a friendly psychiatrist, take some sick leave, medications to tackle stress or depression take 2 to 3 weeks to work. And if you take them, you feel well, you have to carry on taking them for a few months and remove unnecessary stress in the months up to the examination. Don't organize too many meetings. Get your publication out of the way. Concentrate on the exam. Don't learn how to say no. Don't be on call for weeks and weeks before the exam. Now, a little bit about the exam now. There will be 32 scores in all, and you have to score an average of 6 in all the stations. You have to have a pass mark of 192 to pass the exam. So every station, every mark is important for you to pass the exam. So this is a typical score in one of the years. So 2 candidates fail, 189, 186. And mind you, you look at the score carefully, very few candidates just missed by 1 or 2 marks, very few, but some of them did. And there's no quota unlike the MLCP exam. All the candidates can pass the exam. So I hope all of you, 13 of you from Malaysia, will pass the exam this year. The examiners are all trained to be fair during the examination. They won't tell you you have done well, or they won't tell you you have done badly. And they're not supposed to have the handphone in front of you. They're supposed to be attentive to you. The silent examiner is actually observing you. They will not prompt you either way, but then you can ask them to reread the question or paraphrase the question, or if you're not clear about a diagram or aerodynamic tracing, you can ask for clarification. In modern medical education psychology, you will be examined one-to-one. In other words, one candidate will examine one candidate will be examined by one examiner, and there'll be independent marking, there'll be structured mark scoring, but at the end there'll be global scoring. And there are 2 examiners. Sometimes there may be an observer examiner, which will be sitting with the candidate, or maybe an assessor examination, walking around, checking that everything is in order. After independent marking, the examiners can discuss or look at each other's marks. And if there are gross inconsistency, they will be reviewed by the examination board. Usually, there are very few gross inconsistencies for the exam, like consistently giving a 7 or 8 and consistently giving a 4. The examiners have been trained not to have any discrimination whatsoever, although we know that there is discrimination, like a female to a male examiner or a young male candidate to female examiner. There is bias according to the age, the gender, and the race. But we try to play this down. And for this examination, the examiner, some of them will know you. In fact, most of them will know you because they are your trainers as well. They are not supposed to discuss with the other examiners regarding your performance outside that station, like whether they are always missing, whether they have done well in the previous exam. The examiners do not discuss your performance in the other stations, in your FIBU and your daily work, and in your confidential report. Each station is the independent assessment station by itself. So don't worry if you have any concerns about your previous performance or your other station. You cannot discuss anything personal during the exam, either way. And if there's a power failure or if there's a hiccup with the technology, there should be silence. Failing the exam will give you a very bad feeling. I know because I failed my FRCS Edinburgh long ago, although I passed my Glasgow exam. So try very hard. Next few months, prepare very well for this exam. who fail, you don't usually fail on 1 or 2 exam sessions. Usually it's like the mark score I showed you just now. It's usually a global performance, global poor performance. So do not be disheartened if you fail, because almost all the candidates who fail will pass if they prepare and go for another round. Those who actually fail are those who do not wish to try the exam anymore. And those who try the exam the next time, they usually do very well, not only during the exam, they do very well in their career. So in summary, I hope that I've given you some tips of exam techniques. I think they're very important for you to pass the exam. I think most of you will pass and be part of the great Malaysian urology. The 4 years of proper training, I think, is the most important, and this is often reflected in the exam if you follow the exam techniques. So if you fail, that usually means that you will benefit from another year of training. I hope you've enjoyed my lecture. Thank you very much and have a great day.